Hi everyone, thanks for joining us. Let's discuss what are the 5 common symptoms that you might have if you have a meniscus tear in your knee. Now, I've written all 5 of them here, and we'll kind of walk everybody through on what is causing those particular symptoms and what in the end, what can we do or you can do for a meniscus tear. Because again, there's a lot of misinformation out there that oftentimes will put fear into people that, geez, if you have a meniscus tear, if you have a meniscus tear, your life is over, you're not going to be able to be active again. And I'm here to tell you that there are a lot of people with meniscus tear out there, and they're doing a lot of activities just fine. They're running just fine. They're working out just fine. They're playing sports just fine. So again, we need to separate the myths from the information out there that's floating around, particularly in this day on the internet. You know, everybody is the doctor as soon as they go and Google something, and they're like, wow, geez, I know for sure that's what I have, and you know, and so on and so on. So let's try to again decipher what are the myths out there and what is misinformation when it comes to your meniscus tear. So the first thing is any prolonged stiffness. Okay, we can add soreness into that too, right? So if you have some pain in your knee, oftentimes it goes away. But then what's lingering is the stiffness that oftentimes is prolonged. So the stiffness can be, again, 1 or 2 days onset, and then it might disappear, and then out of nowhere, you get up one morning, you're like, geez, my stiff knee just does not go away, right? And then also too, you know, when you're sitting around and you feel great after, you know, a long day of being active, you sit around, you get up, and you feel like, okay, this little stiffness, hopefully that goes away because I've been going, because you've been doing a lot of activity, right? Well, that's normal. But then the next day you get up, that same stiffness is still there, and then you have more soreness now, and this just drags on for day after day and weeks after weeks, and it doesn't go away. That's the kind of prolonged stiffness that we're talking about. The next one is popping or clicking. Every single time you bend your knee or you twist it just wrong, or you straighten out your leg, it clicks, it pops a little bit. You might or might not have pain. Some people do have extreme or excruciating pain, and some people might just have a little mild soreness when it happens. So you can't really rely on the pain quality, the pain severity. With this case here, if it pops or click, then you're gonna have to check mark and say, geez, you know, that's another symptom that I might have a meniscus tear in my knee. The next one is swelling. Swelling and of course pain we can add with that too, right? Because swelling and pain typically goes together based upon how much swelling you have in there. You have a lot of swelling there, you can have more pain. You have a little bit of swelling, you might be just sore and stiff with certain leg movement, but that might not be that severe enough there where you can still be on your feet, but you're gonna pay the price later on down the road. Now, typically, this is the hallmark sign, right, of something that's injured, particularly in this meniscus tear. When you do more things, it's gonna get worse. If you have arthritis without a tear, all right, then when you do more things on an arthritic joint, it actually will feel better. Not with the meniscus tear. It actually will irritate it and make it worse on some cases on a pain level wise. Now, mind you, I did say on pain level wise. I didn't say that's gonna make the meniscus worse. And we'll talk a little more about that at the end on what makes or doesn't make the meniscus tear worse. The next one is pain with twisting or bending your knee, right? Now this is probably one of the most debilitating things that most people will undergo before they take some action to go see their doctor, see the orthopedist, go and have PT, whatever it is, you know, right? So pain with twisting is oftentimes the one that knocks them down, and they feel like, geez, you know, I just don't trust myself. When I turn the wrong way, I bend the wrong way and twist this and that, it just does not feel good. Even getting in and out of a car where you have to plant your foot down when you twist and turn, the pain increases. So what that does is that it causes people to be very apprehensive about it. So usually when you're apprehensive about it, about something that causes you pain, what's the first thing that you do? You stop moving, right? And you stop doing things productively for it, even though it helps you. People are afraid to do it because they have pain. So what happens? The knee just gets worse and worse on a functional level, even though the tear might not have gotten worse. Let's go to the next one, inability to extend your leg. Now, straighten out your leg is another difficult thing, because when you straighten out your leg and you have a meniscus tear, you might have a little fragment that's sitting in the in the joint there that's impinging or putting more pressure. Again, those are what we call ligamentous, right? So soft tissue, and when they scar up or heal up or have adhesions in it from a tear, it's kind of grate and grind near the joint, or that joint will put pressure on that tissue, which has a lot of nerve sensation in it, hence you're gonna have pain. So when that happens, patients will oftentimes not want to extend the knee or straighten out the knee because they have pain. So these are some of the very common symptoms and signs that people will go through when they have or possibly have a meniscus tear. Now, with that said, what can you do if you have some of these signs, right? Or if you have some of these signs and you find out and you're afraid about it and you go to your orthopedist, they do an MRI, and lo and behold, you do have a meniscus tear in that region, be it a lateral meniscus tear or a medial meniscus tear. What are the steps that you need to take from now on? Now again, if you're gonna be going to a surgeon, you're gonna have to expect that if it's bad enough, they're gonna say, hey, you know what, Mr. Jones, you're gonna need knee surgery. You're gonna need me to come in there, clean it out. Again, surgeon, that's what he does, or that's what she does. They're gonna do their job, whatever is necessary for you to get more function out of that joint. I'm on the other round where, hey, if you don't need surgery, not that we're against surgery, hey, if you can't do it without it, why not? Do the right things as long as it doesn't make that worse, right? So let's go back to, does it make your meniscus worse if you have some of these signs here, or all of them, and if you have a meniscus tear, right? Can you make it worse by being active, by bending your knee, by straightening out your leg? Would it tear more? Well, let's think about this logically, okay? Before you tore that meniscus, you were able to bend your knee properly, you were able to twist properly, you were able to straighten your leg out without pain. And or it doesn't tear it more. So why now, when it is torn, we're doing the same thing, normally in the normal circumstances would make it tear more. Now, think about this. If your shirt is already torn, right, would doing normally the things that shirts do, which in this case, wearing a shirt, would that make it tear more? Of course not. You would have to do something really traumatic to that meniscus to tear it further. So going through the normal things that you normally would do, like straightening your leg out, twisting and bending, that's not gonna make it tear anymore. Now, I'm not saying that it doesn't cause you to have more pain, right? We have to decipher, is it pain that is increasing, or is it pain increasing and that you're tearing it more? And I'm here to tell you that just because the pain is increasing, it does not mean that your tear is getting worse at all whatsoever. Because why do we know this? Because we know for a fact that there are a lot of people out there that walk around with meniscus tear and they have no pain. So guess what these guys are doing, or these gals are doing? They're going out there, they're playing golf, they're playing tennis, they're working out, they're stretching, they're doing all sorts of things for it, and they're running, and the tear does not get worse because hence they don't have pain, right? But oftentimes it doesn't get worse because why? You're not doing anything damaging to it. Again, as long as you're not doing what? Creating a really high amount of stress or repetitive stress where your body cannot withhold that threshold. So hence, anytime, doesn't matter you have a meniscus in there or not beforehand, or normal knee without meniscus there, if you're putting your body to a exuberant amount of stress more than what it can handle, you're gonna create tear, right? So if you stay within a realm where your body can handle and you gradually build up the pressure and strengthen your knee up, the meniscus will heal up in the sense that the tear will scar up, and it might not be ever normal. You're always gonna have a tear in there, but it's gonna scar up, it's gonna adhere, and you're gonna have a normal secondary portion of your knee, right? A knee that has a tear without pain, without inflammation, and then you're gonna be able to go through all your functionality properly. You're gonna be able to stretch and move things and be able to go back and trying to rehab it back. So now let's go from what can you do at home, okay? Talking about rehab, rehab or PT that you can do for it, one of the biggest things that I see that are very beneficial for my patients, even when they have a tear, is that they should start to do gradual. Now again, if you have a pain level that is an 8 out of 10, you don't want to go and start doing heavy squats, right? Or lunges, anything like that, right? But if your pain level is 2, 3, or 4, and you're not in the exacerbated stage where you really have a lot of swelling, and you can do a squat where you can go down 3/4 of the way or go down fully and be able to sit up, be able to stand up and sit down on a chair, you need to start doing squats without weight. Just every single time you get up from a chair or from a seated position, do 5, 10, 15 squats, however many you can tolerate, right? Just do that every single time you get up from a chair, okay? And then, so you do that so you get up in the course of a day 10 times, it might be 50 times you're doing it for a total of 50 squats at 5 times each time, or you might even do as much as 100, 150 squats a day at 5, 10, or 15 increments each time. You will be amazed how much that would do and help out your meniscus, even when it's torn. Because I promised you, we just went through this for the past 5 minutes, you're not gonna make it worse. You're not gonna tear it even more, just because you have pain. So that's just some of the gems that hopefully, I can get my point across that, again, if you have all these symptoms, it's not gloom and doom with a meniscus tear. And with a meniscus tear, there are very productive things that you can do for it. Start with the squats and then gradually proceed into other exercises that are strengthening exercises for your knee. And again, we'll be walking through other exercises that you can do for your knee further down the road with our channel. But thanks for joining our channel today. Please subscribe and like our channel if you like our content. And anytime you have any questions, please let us know. Thanks.